what's the name of the podcast again?
Point,
Welcome,
point.
welcome to Point to Point Podcast. I'm Robert, and this is Tony.
Good evening, people. Thank you for listening to us or watching us. And tonight, we're going to talk about practice setting. We say it's a practice. It can be nursing home. It can be clinical setting in clinic, hospitals, like. So they all have different things we need to be aware of. Or in like school settings, the internships is a little bit different than your own clinics. And then work in a hospital or nursing homes or senior assistant center, they all have different settings and protocols and things that you have to be more mindful. Yeah, we could do a compare and contrast what is EC in doing the clinic versus in the real clinic that you work at. Yeah, we could do that one first.
Okay.
Then we mention different setting like a nursing home. That's based my experience. So in past couple podcast episodes, we mentioned about our school clinic experience, but we never mentioned is it stressful, what we need to look for. We talked about the bedside matter, right? So in students setting, it's actually very easy. The most stressful part is to me is that we paying them and we treating them. We do all the work.
There was many of the day-to-day operations when we were in student clinic. The clinic overseer for that shift, who was a licensed acupuncturist, he did most of the treatment decisions for the patient. Depending on who it was, either they would tell you what points you use or we would have a discussion. The discussion usually was good because it was a learning point of view. Could we use this point? Can we use that point? Everyone, there was a bigger discussion with it because there were at least 4 or 5 people inside the room. Each one of us got to ask questions, especially if we felt that there was something that we wanted to add on, either in their file or if we, kind of noticed something with the patient that kind of was glossed over by whoever was doing the interview at the time. There was a less likely chance of missing something, which was kind of nice. And the clinician kind of directed you towards what you should be looking at.
Well, for my part, I think because I actually went to multiple clinicians
Yeah,
to
we all did.
experience different knowledge, and plus probably I want to finish the clinic rotations. I went to Manhattan, I went to Palmdale, and also stay in Mineola because that's where we had all those 3 different locations back then. Every one of the clinicians or the supervisor, they do things very differently. One of them, they don't trust the students at all.
Yep.
Okay, this is the point. Do it. There's no crushing ass at all. I heard from students that that guy used to take measurements. He, he mark it. Okay, put the dots here and dot there. Okay, this is the right treatment point. Don't screw up. There's no really interactions other than I don't trust you, and this is how I do it, and do it. Then another group, like similar to you, that we discussed the questions like, is it liver young risings or kidney problems? What's the under the roof for us? We basically were talking about how to diagnose a patient. What is the possibility? Back then, I was like, my mind, like, I'm kind of a little bit nervous. I don't think I'm that great in diagnosing a patient's symptoms, but somehow what I always say is always correct, and my partner's or classmate is always incorrect. I'm like, oh, great. She make me look, I'm so brilliant too. And the professor said, why you don't be more like Tony? You have to understand the diagnosis correctly. I'm like, oh, great. So at least in the students clinics that you can mess up. There will be someone there to cover up the mess. That's one things, good things about the students clinic is that you can mess up so much, but there will not be a major impact on your license because you have no license to begin with. You practice under their license.
It's more that the patient actually agreed to it because it's a lower
Yeah.
priced acupuncture, which is, and again, that's nice because the school got at the time when I was there, they used to hand out little cards and it would just be $25 a treatment. They gave all the students the cards that were in student clinic just to give out to people because we wanted people to come in. We needed those people to come in so we would see all the different types of issues. Now, I have to backtrack a little bit here because I need to at least clarify something with you. My whole thing about speaking along with all the other people inside the clinic, generally speaking, that fell under uh, my herbal clinic, not so much as the acupuncture clinic. My acupuncture clinic was pretty close to what you had as well. I had a great deal of different supervisors that I worked under. Some were very good. As I've mentioned before, I had one who was very meticulous about the way that they did their intake. They asked a lot of questions. They were very thorough. They had a very good bedside manner and they did a wonderful job. And it's something that, improved on the way that I do my diagnosis and my treatment. I had another person who was just hurry the hell up. You're not doing the intake fast enough. We have to get them into the room because the next patient's going to be here in 10 minutes.
Go, go, go.
And there was one time we didn't even have the supervisor. The supervisor disappeared during the shift.
No, you're
The
not supposed
patient
to say
and the
that.
patient came
Nothing
in.
legal. It's everything legal.
And the patient came in and they're like, we don't know what to do with this person and we can't find the supervisor. I said, don't treat him.
No,
You're going to get in trouble.
no. The funny with that thing is, at that time I also working
Mhm.
a lack of students, interns. I have to drop my work to treat the patients, to do the diagnosis, right? Everything's no,
You can't work
I
during your study
I don't
time and
remember
you can't study
why
during your
there's
work
no
time.
students, interns there.
Oh,
A couple of times I had to, okay, from my job, I had to do two roads.
okay.
As a worker, okay, check them in, okay, and they put the white coat in and start treating patients. So that's the teaching clinic.
Yeah.
So the real clinic is, look, you're on your own. You cannot afford to screw up, especially HIPAA. I have a lot of people who don't know what the heck is HIPAA. I have a worker today who just mentioned that person's name. I have a lot of patients sitting in the waiting area. He asked me, does so and so have a stroke in the past? I shook his head like there's a patient there. But I can tell you it's no. But I mentioned to him that look, if we have patient there, you just said full name, first name, last name, you could identify this patient and you just saying that he had stroke. If I say yes, that's against HIPAA already. A lot of them they don't aware. Many of our students or any when they graduate too, they don't know what is really violations of privacy. Some of them they think just by not having the birth dates on the printout, oh, it's okay. I'm like, no, you still can identify this person first name and last name and this
Correct.
problem. It's just that we really need to be cautious. Some patients they don't mind if they trust you, if they've been with you for a while. But what happened is stuff being transferred to the husband. Oh my God, my wife is pregnant. That's a big lawsuit. It's not by him, by someone else. Ooh. Congratulations! Oh, you're gonna be a father. Well, what the hell are you talking about?
Oh,
That's happened. I remembered a patient's asking about, oh, my husband make this so many appointments, but I wasn't here. Can you tell me what's his appointment so I can make it together? Oh, that front desk is almost tell her everything. I'm like, nope, sorry, I cannot give you that information. Why? I know you're husband and wife, but because of privacy, I cannot say yes to anything because I'm in charge. The odd thing is, if they always together, if the husband make appointments without letting her know, that's a red flag already. Maybe he don't want her to know. Maybe he wants to stay away from her. Because this person is really hard to deal with. She talks so much. She's like Karen. Maybe the husband wants to stay away from her. What happened in divorce situations, and I have a couple patients that they came in as a couple, a couple years later, or a couple months later, they filed for divorce. Yeah, it's I think 3 or 4 times already. That's a lot. So what we said to the patient is very important because this is your clinic, or if you work for someone else, your license is on the line. That's very common things I noticed. Even our professors very common to blur out things. Because for me, I'm very careful not to. I had to make sure this is 100% that you will have to use your own judgment.
Mhm.
If it's a brother and sister, they okay sharing information. You know they share informations, but certain informations you have to be more mindful. Oh, is my brother in for treatment? Which room? I have to give him something. So that setting is different than also is much different compared to the hospital or nursing home setting. I've noticed certain things that the school never teach us that much. I have a patient, couple of them, their mind is all really screwy. But this patient in particular, I was a little bit more aware of because every day, every week I see her, I know her expression and behavior. Then all of the sudden, she acting not herself. So I feel a little bit huh? So what are we going to do? Are we just pretend nothing happened, just treat her? But for me, I'm a very careful person, so I do a little bit more thinking and asking more questions. I asked her, "Is any of your medication being changed in the past couple of days, or at least a week ago?" Because before she was okay and stuff. Then I noticed her heart medication had changed. They increased her dosage, so that medication is not suitable for her. So she get auto mental status. She don't know where she are.
Mm.
That word back then. She don't know the locations. Her mind is like with the off. Don't know the time. So that's the information I learned as a pre-hospital care EMT that you have to ask like, where are you now? Do you know your name? And do you know the time of the day of time? So that's make sure that this person is alert. So in nursing home settings, I witnessed this person wearing alert. So I had to advise the patient to calm down that your medications might not be good. So I spoke with the nurse that her mind is a bit off today. But I think most acupuncturists like, oh, we're just treated as goodbye. So it's as a treating provider, you have to make sure your patient is safe. And if the medication is not good, you have to inform someone. If you stay quiet, what happened? The person passed away to overdosage. That's very common. This is we don't teach that in school.
No.
So it's not a clinic setting. If our clinic setting people come, you do blood pressure is too high. Oh, I'm sorry, I can treat you. But you will not have this patients like, oh, where am I? So you have to be like, oh, okay. So, oh, this is not my clinic. This is hospital setting or nursing home setting. Yeah, goodbye. But what happened if the person passed away and you're the last person that be seen? Oh, uh, How do you argue that? Cameras is everywhere and they know you're the last person to touch the patient. So there's a lot of things that a lot of people out there need to understand, the acupuncturists, especially the new ones. This is like kind of street smarts lessons thing. You have to learn that different settings have different rules and regulations and how to protect yourself. You have to learn how to protect yourself better. If you have got a feeling that something is wrong, please say something. Problem with patient in nursing homes. Once you're in nursing homes, it's like a prison. You don't get out or to go out to be free that easily. So this patient asked me, okay, she was really upset. She was crying. Then she said, I don't want to live myself anymore. Then what alarmed me is that she said, she made a statement. I want to jump out from the window. I'm not sure if any of you have experienced that, but what you're supposed to do. A lot of them might be panicking and leave, pretend nothing happened. One of the rule is if a patient have a suicidal thought, you have to call in.
Yes.
In your clinic, you have to dial numbers. If anything happened, you're screwed. Because as a healthcare practitioner, by law, you have to report that. For me, I don't need to call 911 or call the hotline. I just had to report it. A lot of you might just say, okay, I report the nurse, that's it, and leave. You cannot just report to anyone. You have to make sure that the administrators, people document it, and they actually doing something. It took me maybe 15 minutes to find the person, or actually not person. We found a group of people. They are RN, and they are the administrator level. Why? Because they chit-chatting and giggling. So when I mentioned, oh, the person's want to commit suicide, she want to jump out through the window. The worst thing is they were laughing, giggling. My questions to you guys out there, what will you guys do in these situations? Okay, I report them, I will leave. Because by law, I protected already, I've done my part already. But for me, I did not stop there. So as a practitioner, any patient that you treat, your obligations is to make sure the well-being of the person. You make sure that patient get the right proper treatments before you let go. That is actually the law. If you think, okay, I'm okay, but if something happened, you also have faults because if you know the nurses is not taking seriously, then if something happened to her, still you're in trouble. Yeah, we don't have patients coming for suicidal. We have patients who are cuckoo,
Yes.
doesn't medications wise. But what do you do? Come on, you have to dial 911. Even though back then a lot of people disagree, the administrative part, you should not dial 911. But heck, look, if you're working for some clinics and you practicing under your license too, because you're a trained provider, something went wrong, I don't care what the boss said, I dial 911. Because if you don't dial 911 and something happened and cause problems, or the patients get out of hand or something injure themselves, you also at fault because the boss will not protect you. Something happened because it's hey, he's a trained provider. So that's my stories. It's very interesting because I learned it on my own. Just letting you know, the school didn't teach me anything about it. A lot of things that the school don't mention too well because they just go through the book. There's no life situations. Not many acupuncturists experience these situations like myself because I've been doing that in nursing home for maybe 4 or 5 years. Different setting, different nursing homes, not just one area. I have to be smart because I have to protect myself because I live by myself. If something went wrong, you know what? The nursing homes, doctors and nurses will just point fingers on you because you're the odd person there. they will not share the blame. It's easy to be a scapegoat for them.
There's one thing I want to touch up on that you had mentioned, and that's documentation. And we
Mm.
should talk about that both in the student clinic and your own clinic situation. Even with what you were mentioning at the nursing home, everything should be documented. And that's another problem that I used to see between the student clinic and my own clinic. When you have your own clinic, you document everything, anything and everything, even if you think that it's not important. Something that patient says could be something that you want to go back to.
Right.
In student clinic, you learn how to do the intake, but you kind of miss out on some of those little details. Either the clinician misses it or somebody else's misses it. As I'd mentioned earlier, some people ask some questions that maybe they see something that you don't. But in the end, they would never write it down because they weren't the person doing the intake. Let's say, for example, you're doing a treatment on somebody and you forget to write it down, or you just, you were busy that day and you forgot to write it in the person's chart. But then they end up having a problem. They come back to you, you have the lawyer, and they're like, well, you don't even have this treatment documented. How do we know you did the right thing? How do we know that, the patient told you that they weren't feeling well that day? You didn't say anything about that inside your report. And that in itself, that's a huge problem right there. I think it's considered malpractice.
That is so true. Yeah. If you don't document it, that's when you think treats. That is
Correct.
true.
That's
Let's
simple.
go through any treatments, every different practitioner, doctors, even technicians. Yeah, that's how the lawyers work. What's the proof? I remember this on news. This EMT paramedics were getting sued, FDNY paramedic, because motor vehicle accident. So this patient claims that this paramedic did not put or splint the boards or whatever stretcher, anything that the noise can find, because that guy was by himself. He did not document any documents because
Mm.
it was multiple injuries. He was so lucky that the reporter took a picture of the patients, that he put all the stuff there. He followed the protocol, the procedures 100%. That saved him. If not,
He's lucky.
he will lose his license, and he will never be working in the FDNY again because he will be banned. Good thing the reporter had the picture of the guys, so he followed all the protocol, direct procedures that the lawyer or the victim claimed that he never received.
Mm.
So that's actually covered him. If not, it's considered negligence. It's not real malpractice. So if you do malpractice, and the insurance will cover for you anyway. But negligence, I don't think the insurance will cover anything. So basically, the guys can be sued for personal injuries, and the city will be okay. It's not our problems.
Thank you all for listening to us today. We hope you enjoyed it. If you have any comments, please leave it down in the section below, and we'll talk to you next week.
Thank you so much, people. Good night.
Good night.